Hi everyone, today I'll be talking about the APC gene, a critical tumor suppressor that protects against colorectal cancer. The APC gene is located on chromosome 5q22 and produces a large 2,843 amino acid protein that acts as a scaffold, bringing together other proteins that control cell growth, division, and chromosomal stability. Structurally, it contains a beta-catenin binding domain and axon binding domain in its central region, which are essential for Wnt beta-catenin signaling. It also contains a C-terminal region that helps maintain chromosomal organization during cell division. APC's role is critical in tissues with high cell turnover, like intestinal lining, where it prevents uncontrolled cell proliferation. When APC is mutated, this regulation is lost, leading to excessive cell growth, polyp formation, and eventually colorectal cancer. Let's first explore what APC does in healthy cells. In normal healthy cells, APC functions as a tumor suppressor, meaning it prevents the formation of tumors by inhibiting uncontrolled cell division and maintaining genomic integrity. Its most critical role is part of the Wnt beta-catenin signaling pathway. This pathway regulates cell proliferation, differentiation, and tissue renewal, particularly in the intestinal epithelium, which has one of the highest turnover rates in the body. Here's how the pathway works. When Wnt signals are absent, APC teams up with proteins like axin, GSK3-beta, and CK1 to form what's called the beta-catenin destruction complex. This complex phosphorylates beta-catenin, marking it for ubiquitination and proteasomal degradation. As a result, beta-catenin levels remain low, and the Wnt target genes like MYC, CCND1, and others that promote cell growth stay inactive. In this way, APC acts as a regulator, preventing unnecessary cell division when growth signals aren't present. When Wnt signals are present, they bind to frizzle receptors on the cell surface. This blocks the destruction complex, allowing beta-catenin to accumulate and move into the nucleus, where it activates transcriptions of genes that are needed for cell proliferation. This regulated activation is essential for normal tissue renewal and repair. Beyond its role in signaling, APC has several other key functions. It binds to microtubules through its C-terminal domain, helping ensure proper chromosomal segregation during mitosis, and it interacts with E-cadherin and beta-catenin at the adherens junctions, promoting cell adhesion and maintaining tissue architecture. Let's look at what happens when APC is mutated. APC needs both copies of the gene to be inactivated for cancer to develop. Individuals with FAP will inherit one defective copy, and over time, a second somatic mutation occurs in colon cells. This second hit triggers the tumor formation. More than 90% of the disease-causing APC mutations are truncating mutations, either nonsense or frameshift, that result in a shortened, non-functional version of the protein. These mutations often cluster in the mutation cluster region, between codons 1250 and 1464. Why does this matter? Because these proteins are truncations that remove the beta-catenin binding and downregulation domains, APC can no longer assemble the destruction complex. As a result, beta-catenin is no longer degraded, it accumulates, enters the nucleus, and continuously activates growth-promoting genes. This creates a constant on signal for cell division, even in the absence of WNT. The outcome? Uncontrolled cell proliferation, the formation of polyps, and over time, the accumulation of additional mutations in other oncogenes like CRAS and tumor suppressors like TP53. All of this can drive progression to colorectal cancer. Additionally, the loss of APC disrupts cell adhesion, so cell becomes disorganized and lose their polarity, contributing to invasive growth, a key feature of malignant transformation. The cancer most strongly linked to APC mutations is colorectal cancer. In familial adenomatous polypsis, or FAP, hundreds of thousands of adenomatous polyps form in the colon and in the rectum, often starting in the teenage years. If not managed correctly, nearly all FAP patients develop colorectal cancer by middle age. Even in sporadic cases where no inherited mutation is present, APC is mutated in 80% of colorectal tumors, highlighting its central role in tumor initiation. But why the colon? Well, because the intestinal epithelium depends heavily on Wnt signaling for cell turnover. APC is highly expressed there, constantly regulating stem cell proliferation at the crypt base. When APC is lost, Wnt signaling is permanently activated, causing an unchecked expansion of these stem cells and formation of said polyps, the earliest step of colorectal cancer. Currently, there are no drugs that can directly restore APC function, but several strategies aim to prevent or manage APC-driven cancers. In FAP, individuals begin colonoscopy screenings as early as age 10 to 15. When the polyp burden becomes too large, a colectomy or surgical removal of the colon is performed to eliminate the cancer risk. Drugs like Selindac and celecoxib, both COX inhibitors, reduce prostaglandin E2, a molecule that can enhance Wnt signaling and inflammation. By lowering prostaglandin levels, these drugs help reduce the number and the size of polyps, though they don't fully prevent the cancer. New approaches aim to target Wnt beta-catenin pathway downstream of APC loss. Porcupine inhibitors block the secretion of Wnt ligands, and tankerase inhibitors stabilize axin, enhancing beta-catenin degradation even without APC. These are still in clinical trials, but they represent promising targeted therapies. In summary, the APC gene is the master regulator of Wnt signaling, chromosomal stability, and cell adhesion. When it's lost, these control systems collapse, leading to uncontrolled proliferation, genomic instability, and colorectal tumor development. Although we can't yet repair APC directly, early detection, preventative surgery, and emerging pathway-targeted drugs have transformed outcomes for patients with APC mutations. By understanding how APC functions and fails, we've taken a huge step towards predicting, preventing, and controlling one of the most common cancers worldwide. Thanks for watching.